From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Health System fully supports the Catholic Health Association's vision for U.S. healthcare. In October 2010, the Catholic Health Association published their updated document, Realizing Our Vision for U.S. Healthcare, which compares the Affordable Care Act with CHA's vision for U.S. healthcare, and Bon Secours Health System wants to throw its support behind that vision. Catholic-sponsored healthcare providers have been working on behalf of a fair and universal healthcare system for decades. In 2007, the Catholic Health Association collaborated with leaders from across the ministry to develop their vision for U.S. healthcare. In 2010, President Obama signed into law an historic health reform measure that provides coverage for an additional 32 million people. CHA worked closely with members of Congress, the White House, and other groups to make sure that the legislation protects life from conception to natural death. Today, we'll share with you the comparisons of the Affordable Care Act and CHA's vision for U.S. healthcare, and we'll tell you how to get more information so you can advocate for U.S. healthcare too. CHA's vision acknowledges that healthcare in the U.S. should be available and accessible to everyone, paying special attention to the poor and vulnerable. The Affordable Care Act expands health insurance coverage to 32 million people who are currently uninsured. It limits insurance companies' ability to charge significantly different premiums based on factors such as age and health. Healthcare in the U.S. should be health and prevention oriented, with the goal of enhancing the health status of communities. The Affordable Care Act requires qualified health plans to provide free coverage for preventive services. Includes Medicare coverage for developing and following a personalized health and prevention plan. CHA's vision states that healthcare in the U.S. should be sufficiently and fairly financed. The Affordable Care Act provides $250 million over 10 years to pay for counseling, education, job training, and housing for vulnerable women who are pregnant or parenting. It provides federal grants to reduce chronic disease rates and disparities in the amount and quality of care received by minority groups. CHA's vision states that healthcare in the U.S. should be transparent and consensus-driven in allocation of resources and organized for cost-effective care and administration. The Affordable Care Act funds research, extends the life of the Medicare Trust Fund, requires insurance companies to clearly describe coverage and benefits, increases payment to Medicare and Medicaid primary care physicians, and requires not-for-profit hospitals to assess the needs of their communities and adopt and publicize a financial assistance policy for patients. CHA's vision states that healthcare in the U.S. should be patient-centered and designed to address health needs at all stages of life, from conception to natural death. The Affordable Care Act requires development of a national strategy to improve health care services, medical outcomes, and population health. The law phases out the Medicare drug coverage gap known as the donut hole so seniors can afford their medications. CHA's vision states that health care in the U.S. should be safe, effective, and designed to deliver the greatest possible quality. The Affordable Care Act requires development of a national strategy to improve health care services, medical outcomes, and population health. It enhances collection and reporting of data. It builds on efforts to expand the use of electronic medical records. It supports research to compare the effectiveness of medical treatments and share the findings with doctors and clinicians. Yes, the Affordable Care Act is here and needs your support. To find out more about the Catholic Health Association's vision for U.S. healthcare, go to www.chausa.org. The Affordable Care Act, the Catholic Health Association, and Bon Secours Health System, working together to build a more humane world, improve health, and model social justice. In other news, on November 30th, 2010, in a memo from BSN President and CEO Rich Statuto to the Leadership Conference and HSO employees, Rich Statuto announced the promotion of Jeff Oak and Bryon Neaman to Senior Vice President of Corporate Responsibility and Senior Vice President of Internal Audit, respectively. Jeff Oak joined BSN in 2005 as Vice President Corporate Responsibility Officer. During his tenure, Jeff has grown the corporate responsibility function, including rewriting BSN's Code of Conduct, creating system-wide education to raise employee awareness, re-engineering the conflict of interest process, and recruiting and strengthening the corporate responsibility function in all local markets. Bryon Neaman joined BSN in 2002 as Director of Internal Audit and was promoted to Vice President in July 2004. During his tenure, Bryon developed and led various initiatives designed to expand further the reach and influence of internal audit in supporting the BSN Strategic Quality Plan. Additionally, Bryon cultivated effective work relationships with the system and local system boards and has championed numerous governance improvement initiatives specific to the audit and compliance committees. Bryon clearly champions talent management and successfully positioned many of his current and former team members to assume leadership roles within BSN. Please join us in congratulating Jeff Oak and Bryon Neaman as they take on their new responsibilities for Bon Secours Health System. Finally, on November 29, 2010, in an article in the Virginia Pilot, it was announced that Bon Secours Health System, Inc. donated $40,000 to the city of Norfolk to help build Bay Oaks Park. Bon Secours donated the money recently to the city as part of its efforts to help revive East Ocean View. According to Darrell Crittenden, Director, Recreation, Parks, and Open Spaces of Norfolk, the gift will allow the city to build a small playground at the park. Bon Secours made a 15-year commitment to work in East Ocean View last year. The community is a diverse mixture of low-income housing and posh waterfront homes. A majority of East Ocean View's 7,000 residents are low-income renters, city officials have said. Other efforts by Bon Secours include the recent repair and expansion of a food pantry at the New Life Christian Church. That project was in conjunction with Operation Blessing. And during the summer, both Bon Secours and Operation Blessing teamed up again to establish a community garden at 18th Bay and Pretty Lake Avenue. According to Steve Zolas, Director of Healthy Communities in Hampton Roads, to our delight, the garden was not only respected by the community, it was watched over by the people in the community. And there are other projects in the work, but today's news about the $40,000 gift to help build Bay Oaks Park comes as great news to the community. Bon Secours Hampton Roads, partnering with East Ocean View's communities and Operation Blessing to co-create a more humane world, improve health, and model social justice. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.